truth is, if I can help 4 lakh such patients who are disabled today, earn 5,000 rupees per month, which is lesser than daily wages, I am adding 2,400 crores every year to India's
Not a
GDP.
network problem.
And if I can help another 4 lakh such families
Showing one
save
person
5,000 rupees per month in medical expenses like diapers by training them to use the bathroom and not wet their pants, I am adding another 2,400 crores of phantom money into the system which they can use for the children's future. Because now they use it for diapers. So all I am saying is this is really a public health hazard today. We cannot afford discipline. Patients do not die for 40 years. It's a big problem for us. So we are dealing with a big thing. Next, all of you know about this. This is the latest stuff. VR, AR, MR. All of you are familiar with most of these words. I'm quite sure about it. You know, everywhere, even if you're not familiar, you've heard of these words. Robotics, you know, in other fields. So, I come from a world called RR, which is real reality. My patients are real. Their suffering is real. Our treatment is real. The results are real. So let me show you some results of some misbehaving or thoroughly brain circuits. So this is a patient. This is the first part of the work I do, neuromodulation. My colleague, Dr. Sanjeev CC, is there in the front. He is a very senior movement disorder neurologist. We work together to produce this because he has to diagnose these patients for me to operate. So this is the patient. Many of you know there was a patient playing guitar during brain operation. That video had gone viral all over the world. This 2017. That was done at Bhagwan Mahavir Jain Hospital. Volume, please. You see there? Volume. Hello. These 3 fingers of his left hand he is not able to move. He is not paralyzed. He is fine. MRI is normal. Only when he tries to move, he has this problem. Little more. Only when he holds the guitar, this happens. No guitar, no problem. Careful, careful, careful. Little less. Okay. This is called guitarist dystonia. So this is because of misbehaving circuit in the brain. So I had to burn a circuit in the brain when he's playing the guitar. That's CC Sanjeev there. He's in the OT. I have put a probe into his brain to burn a circuit while he's playing the guitar. This first time in India this happened. These surgeries are not being done in Apollo Hospital, Manipal Hospital, nowhere it's being done. We were the first to do it. We trained in Japan for this, that's why it was possible. I am 9 centimeters inside his brain, not millimeters. 9 centimeters inside the brain. Thanks to technology, we're able to do this. As I'm burning the circuit, the finger is better. You can see his finger is better. He had problem in typing. You see left side, the fingers are curling while typing. Right side, he's able to type normally. Whatever problem he has, I have to check it, like circuit checking on the table. Every circuit has to be checked to make sure I've got it right. This is him. You see, this is the burn in the brain. This is how deep inside the brain I have gone. 9 centimeters inside the brain through a 14 millimeter hole. I cannot see anything. It's technology that guides us to get this spot right. If I burn the wrong circuit, I'm in deep trouble. So that's what it is. Burning wrong circuit is equally bad as not burning the right circuit. This is him with his first performance. Look at his fingers. This is him 6 months after surgery. Look at the fingers now. Each finger. See that? So beautiful, he's got control. Seeing him, this Bangladeshi guitarist came. He was a professional guitarist. This guy was amateur trying to be a professional. He did not even tell his parents he's going to undergo brain surgery. He said, I'm coming for a test. He came in. Look at him. He used to play guitar 8 hours. Look at it like Ashtavakra. He's not. Look at his fingers. It's worse than you and me trying to play guitar for the first time. He could not make this C. The right hand is okay. Left hand C he could not make, which was very important for guitar playing. He could not text. He can text with the right hand. He can't text with the left hand. You see how the hand is going? These are all dystonias. It's like your hand is not listening to you. He can't flip a coin with his left hand. See how clumsy that is. MRI is normal, CT scan is normal, blood test is normal. But you have a third circuit going on like this. He couldn't pick up coin from his pocket and give it as chiller to people. That's how bad it was. So we are operating him, checking all activities on the table. Playing the guitar, flipping the coin, texting, all checking on table. And as I'm burning, it's getting better. Then, this is again deep inside the brain. You've done that circuit. There's the Jugalbandi, the two guitarists playing together. They're so happy, both of them. So 2 months, 3 months after this surgery, how safe is this surgery? This Bangladeshi guy is a mountaineer. So he climbed a 7,000-meter Himalayan mountain 3 months after my brain surgery. He called me, "Doc, I want to go to trekking." I said, "Are you crazy?" He said, "I'm feeling fit and fine." He has done this trekking 3 months after this brain surgery, which means it has not harmed any other part of his body. That's how precise you can be. And half a millimeter this side, that side, he can get paralyzed. It's how critical that is, yet he is able to do this. This is him 9 months after surgery. You can see how fast his hand is moving. See the fingers. So then this is writer's cramp. That was guitar cramp. This is writing cramp. Some people have difficulty in writing. Suddenly the pen stops writing. It's called writer's cramp. It could happen to anybody, you, me, anybody around you. It doesn't have to be familiar. It can happen to anybody. This is a 26-year-old guy trying to study to be an IAS officer. He had this problem. You see the way he's holding his pen. You can't see the thumbnail after some time. He's getting into a very funny shape. See, look at the way he's holding his pen. Terrible. This is his handwriting 2 years before the writer's cramp. 1 month before our surgery, the day of the surgery, he could write only half a page. After that, the hand stops. It just doesn't move forward. Udhar atak jata hai. It just gets stuck in that place. So we did the surgery. This is him after surgery. Writing comfortably with no pain in the hand. So more importantly, look at this handwriting, how much it has changed. Writing with gel pen, ballpoint pen, plain paper. Dramatic. This is what is functional outcome. Otherwise, it cannot be operation successful, patient died. We also have to have outcomes. Outcome is most important at the end of the day. This is him writing. You see how nicely, very comfortably he's holding the pen. No discomfort in the hand. Next, let's go to this. This guy was a photographer who had a severe head injury. He's from Gundlupet. He had this problem of hand tremor. Now you see here, when he tries to pick up the bottle in the left side video, he's struggling so much. The middle video, he's gotten better. He's about 70-80% better. You see the first video to second video. How much better it is. This is him 1 year after surgery. Little anxious because the video is being done, but he's able to manage himself. Little difficult when they have a scar in the brain, but still possible. I'll show you the next one, which is more dramatic. This boy had a head injury when he was 9 years old. He was trying to cross the road to go to school, which happens to our children and grandchildren. Somebody came and hit him in front of his school. He was unconscious, recovered after a period of time. For 17 years after this, he was stuck with this problem. For 17 years. Can you imagine? Somebody in your family like this for 17 years. He stopped going to school. So this is him during surgery.
That's nice. We go on to the next 2 hours, this will stop because
that's a special frame we fix to the head, and we do this surgery. This is him second day after surgery. He's able to manipulate the bottle, pick it up. These are all very difficult surgeries to do. He's gone to lots of doctors. Everybody said nothing is possible. Able to pick things up. He learned to wear his shoe for the first time with lace, with both hands. This is him trying to drink water after 1 month. He still has some tremor in some positions, but he's riding his two-wheeler, riding his four-wheeler. He's very happy for the dramatic result that we have given him. Next, Parkinson's disease. I'm quite sure all of you know about Parkinson's disease. So let's look at Parkinson's disease. This lady, I'm quite sure you have seen people with tremors like this. You have seen? I'm quite sure you have seen people like this. 7 years she had these tremors. She would not remove that bangle. Continuously the bangle would make the sound. The family is arguing with her. In the middle of the night, sound is coming. She doesn't care. Finally, so look at this video now. This is in operation. Just look at the tremor in the hand. I am burning the circuit. Keep watching the shaking hand. That is Sanjeev in the OT. Boom, it stopped. Can you see how dramatic it is? Switch on, switch off. This is it. She is fine. Tremor gone. No tremors post-operatively. But hand is fine. Next, this another patient of Parkinson's disease. After surgery, one side burning, he's so much better. Off phase is so slow, as you can see. He's better. He's gotten better. He's so slow in off phase. On phase with medicine, he's like this. But now, with the surgery, he's so much better. It's only one side I've operated, the other side is still not operated. So like this, we have so many patients. This is him. The last video is after 2 months, after 1 year after surgery. Look at how confident he is. You can't even make out he has Parkinson's disease. He's so comfortably walking. He's so happy. I have not cured Parkinson's disease. We have managed the motor symptoms of Parkinson's disease. We have a lot of patients like this. This is a lady, same on, off, one side surgery done. She used to stoop like this and walk. She's walking normally now. She couldn't write. She said she wrote correctly for the first time after 8 years or 10 years. They have problem in signing in the bank. Lot of challenges they have. They have to make the grocery list every day, items to buy. Fundamental basic things. We're not talking about big things in life. So this is her again. I'll jump further. I want to show more other videos. So this guy had this tremor, left side, upper limb. One of the earliest Parkinson's we did. You can see his leg also has tremor. You can see. We operated him. Sorry. He couldn't walk backwards. Before surgery, he started to walk backwards. This is during rehabilitation. Rehabilitation becomes very important for us. He wanted to read the newspaper without his hand shaking. So we are testing that. He's able to read that. He's able to wear his shirt. This is him. 1 year after surgery. He's still now all right. It's been 5 years after surgery. He travels in the bus independently, goes to his children's house. He says, I'm very happy. Quality of life is what we have offered these people. I don't know how many of you have seen patients like this. This patient is referred to me from Sakra Hospital. Even Sakra Hospital doesn't do the surgery. So he was referred to me from Sakra Hospital. He's going like this. He's a businessman from Bangalore. He had like this for 7 years. Imagine somebody sitting in front of you and every minute doing this. You also get psyched up. Baby, क्या हो रहा है भाई? इसको कुछ किधर बात करना मुंह नहीं देख सकता ऐसा हो गया. So this is how it is. Medicines didn't work. This is him.
Watch. You cannot see the mobile because I can see like this mobile. Not the interaction of satellite.
Even in wedding posing, he had to look like this. He could look towards the camera. That's what he would say. So, this is the burning inside the brain. You can see two globs here. This is how we are born. How precisely you can do it. It's amazing how precise this technology is. This is another patient. This was the first surgery we did in Bhagwan Mahavir Jain Hospital. Cervical dystonia to one side. He had it for 11 years. Did the surgery. Sorry. Post-op day 1, post-op day 4. He's about 70% better. But for him, this itself is very happy. During rehabilitation, with training, he says, the biggest thing is I can sit and watch a cricket match now without any strain on my neck. That's all he wanted, India-Pakistan matches.
Yeah.
This girl came to us from Varanasi. She is fine as long as she's sitting. The moment she stands up, she starts bending like this. She walks like this. She's a BA English. Upstairs is fine. No memory problems. No mental challenges. See, she bends like this. Some strange power is pulling her down like this. This is called right hemidystonia. During therapy, slowly she got better. Here we take 3 to 6 months. She improved. This is her at home after 8 months. And this is her 2 years after surgery. Little bit of foot problem she still has. Otherwise, she's fine. So, can we burn both sides of the brain? Is it possible? People are very scared of doing it. I'm proud to say that we're one of the few hospitals in India which is burning both sides of the brain circuit. Why is this so important? Because the common operation for these things is putting a pacemaker in the brain called DBS. And how many of you heard, like how we put a pacemaker for the heart, we put pacemaker for the brain. The pacemaker costs 7 to 11 lakhs. Plus the surgery is another 6 lakhs. So 18 lakhs. How many middle class Indians can afford 18 lakhs? This burning surgery is 2.5 lakhs on either side in general ward. So 5 lakhs surgery is done. There is no battery. There is no follow-up required at the end of the day. So we are doing this. This is a tailor, a poor tailor. This is how he was, classical Parkinson's disease. Look at him, left more than right. He would walk like this. Look at how the tremors are. He could not even go out of the house by himself independently. He wanted the left side to be operated first. 18 months after left side surgery, you see left hand is trouble. Look at the way he's walking, much better. Left hand no tremor, right hand tremor, because I only operated left side. Right hand tremor, left hand no tremor. Then he came to me and said, Dr. Saab, please do the other side. Between the first and second pandemic. This is him 1 month after the second side surgery, completely gone. Everything is better. And this is him doing his tailoring. He's back to his occupation. Part-time. He's also working in the Victoria Hospital as a patient coordinator. Even in anxious situations, he does not have any tremor, no symptoms of Parkinson's disease. You see how comfortable. Look at the first video, look at this video. It's dramatic how better he is. If you look at this video, you think he's a normal person. You can't even believe he had Parkinson's disease at a point of time. It doesn't matter whether 5-10 years later he'll get worse. At least for 5 years or 10 years, we have given him a quality of life that he can earn money for the family. This got published in the international journal, Romanian Neurosurgical Journal. It's very rare, very difficult to get it published in international journals. Sanjeev was very, insistent, and we got it published there in the, first time, both sides of the brain. Now, this is the people with a pacemaker in the brain. You see here, classical Parkinson's disease, off phase, no arm swinging, slow shuffling gait. This is him when the medicine has side effects. They start wriggling like this. This is also a problem, very distressing. Imagine how can they go for any family wedding or anything like that if patient is like this. Patient cannot go, family cannot go. It's very distressing. The social life gets fixed because of this. Look at him, how he is. He walks like this, like a drunken person. When the medicine is on, he is like this. Medicine is off, he is like that. Both of which is equally bad. This is him after surgery. Pacemaker. You see that result, this result is about the same. Without pacemaker, with pacemaker. But both are good results. Now I'll skip this. Same pacemaker. Now this patient had undergone pacemaker surgery in a reputed hospital. It did not work. This boy is like this for 7 years. Imagine his neck going back like this all the time. He cannot go to bathroom by himself. His mother has to hold him to get better. Look at him now in the left hand side video. Father will leave the head on that side. Look at how the head is going. He will not die. He will be like this for the next 15, 20, 25 years. Can you imagine the quality of life of the family? Distressing. So I had to fix the frame under general anesthesia, fixed him. Look at him before surgery. He can't pick up a bottle of water. Father is holding the head, but look at this. It's that bad. This is just drinking water. We are not talking about him going and earning money or riding two-wheeler. Fundamental human rights. Now he can't even leave the bottle. Father has to hold the left. You see now, father will hold the bottle. He will leave the right hand, then use the right hand to lift up his left hand. You can imagine. I burned both circuits of his brain at the same time. Under general anesthesia, I woke him up. Very risky things to do. With all this, he got better. 2 sides of the brain burnt through rehab. I want to just show you the final. Look at him. Nobody's holding his head. What the pacemaker did not give, this burning circuits did. He's about 60-70% better, but that's okay. Family is still very happy. He can manage himself. Mother doesn't have to take him to bathroom and clean him. He can manage himself. See, sorry. Look at him. The bottle of drinking, you're drinking water you saw that time, you see this time. That's how much we can help. But we need help because such patients have to be referred to us. We are sitting with the skill, but people like you should help us to find these patients in the market because they are going around because Nimans doesn't do, AIMS doesn't do, they have given up in life. They think it's black magic, kuch to ho raha hai. They have given up on life. We need to create hope for them again. If they're in a hopeless situation at the end of the day. This is how the boy is now. He's able to manage himself. He has some balance issues. That's also a degenerative process. But he goes to the fields. He supervises the labor. He's able to manage by himself in the bathroom. This much head is not falling back. He's independent. So the family is happy. Next, I also implant for people with spasticity. I don't know how many of you have seen people with spasticity like this. The classical spasticity example, cerebral palsy. Spastic Society of Karnataka, you must have heard, all the children with cerebral palsy are walking like this, very difficult because anytime the brain or spinal cord gets damaged, it recovers by having tightness. You see stroke patients walking like this, very difficult. Spasticity, in the layman terms, is trying to drive with the handbrake on. You can imagine how tight it is. That's what happens. So we need to release spasticity. It's a very difficult problem. We are one of the few teams which implants pumps in the abdominal wall with a spinal catheter into the spinal cord to release the medicine directly into the spinal cord. The pump costs 8.5 lakhs. We are the biggest implanters of this pump in India right now, but you can see the results. This boy was at Ramaya Hospital for 3.5 months. Severe head injury, deeply unconscious. The doctors had said, this is it. Nothing can be done, please take him home. He had lost weight, he was 35 kilos, he was flesh and blood when he came to us. He was this tight, you can see him. In bad shape. Somebody told my name, they came to Jain Hospital, this is during just the pandemic lockdown had started. That's when he came to us. So we examine under anesthesia, the rehabilitation team comes into OT, does all the examination, makes all the measurements and calculations, and then we put the pump. 1 month after he woke up, this boy, but you can still see his hand is bent like this. If you watch his hand going up, the hand is still bent on the left hand side, extreme, right hand side extreme video if you see. You see the hand is still like this. He slowly got better, started playing chess, started doing some therapy, handling the lift by himself. He's enjoying his birthday, he's cutting his cake. Can you imagine a patient? He still has a lot of problems, he's still wheelchair bound. The family is so happy, you cannot imagine. Because he's doing that. Look at him. He's able to now change the channel on the TV, play what he wants. He's able to keep it down, keep the remote down, pick up chips from his left hand, put it to his mouth. To that level, he has improved. So, look at his language on WhatsApp. Completely normal. So, what I'm saying is his cognition, his memory from somebody who was deeply unconscious has become completely normal, including the emojis. So that's how much we can help. He took rehab for 1.5 years. That's what it is. Then this man had this baclofen again. This is his chats. You see this? Somehow thinks his chats on WhatsApp. So this was a recent patient we did from Yemen. He had a post-bomb blast, 5 years. He had this problem. You lift up his right hand. Look at how he starts shaking. Very severe. He's very distressed because of that. You see how uncomfortable he becomes. He's from Yemen. Look at this. He has to do this to stop that leg from comas therapy, physical therapy, occupational therapy, speech, cognition therapy, memory therapy, psychology, speech, language, swallow, nutrition, cognition, behavior, avocation, and VRER. Everything has to happen together. It's not just one or two. That means it's physics, mathematics, chemistry, biology, English, everything has to happen. It's not one subject at the end of the day. I spoke about this. I want to show you something about this, our rehab results before I end. This boy, Had a very bad head injury. He's from Madhya Pradesh. He came to Bangalore to study. 2 months after head injury, he's like this. Not even looking eye to eye. Ladies and gentlemen, veg and fry for you. That's all from me. Thank you very much. So I call Dr. Pratibha and a few others to give a quick talks on their part. I want you to introduce Dr. Sanjeev. By the way, Sanjeev, this is my partner in crime, as what I say. A dear friend of mine, Dr. C.C. Sanjeev. He's a senior movement disorder neurologist in this side of town. He's one of the earliest in movement disorders, which is one level higher than just neurologist. He is the one who sorts all my patients out for me. I'm like a technician. He tells me, this patient to be operated. We discuss together where to operate. He is the main brain behind what is happening, and that's how, as a team, we make it happen. Thank you very much for being a part of what it is. Thank you so much. Dr. Pratibha, you and your team can take over. Thank you.
Hello. Yeah. Good afternoon, everybody. I know it is lunch time and everybody must be hungry. Is English okay with everybody, or you want me to talk a little bit Hinglish? Hindi come English? Both? Hindi? पूरा हिंदी में बोलूं? आप बैठ सकोगे? मेरे हिंदी सुनने के लिए? My Hindi is not that good, but I'll try. Okay? So, Dr. Sharan ने अभी तक बोला कि how the neurosurgical intervention can be done for the patients. उसके बाद rehabilitation होना है for the patient to get back to his almost near normal life, है ना? तो ये neuro rehabilitation होता क्या है? So I'm going to talk a little bit about that, and I'm going to bring in my team of people who work, all of us work together to bring in that result. मैं अकेली कुछ नहीं कर सकती, ठीक है? So a little bit about what neuro rehabilitation is. Dr. Sharan mentioned about a circuit surgeon he is. So हम लोग ये circuit के ऊपर काम करते हैं, जोड़ते हैं circuits को, ताकि वो जो function जो बंद हो गया है patient में, उसको वापस लाने का काम करते हैं. Whether it is any kind of functions, that we will go a little later on that. Now, who are the patients who we can take up for neuro rehabilitation? So patients who have had head injury, वो road traffic accident से हो सकता है, नहीं तो गिरने के वजह से हो सकता है. Head injury can happen for any reason. It could be stroke patient, different kinds of strokes are there. Spinal cord injury, आपने सुना होगा, एक दो patient का testimonial देखा हुआ है आपने already. Parkinson's disease आपने देखा होगा. Some of the brain infection, meningitis and so many other infection. The other type of brain tumors which probably have undergone surgeries, ये सब लोगों में neurological deficits होता है. वो deficits जो होते हैं functionally उसका जो काम करने का जो तरीका था या ability था वो बंद हो जाएगा ये surgery के बाद, ये कुछ करने के बाद. उसको वापस लाने में हम लोग काम करते हैं. So what does neuro rehabilitation actually do? It's not just about physiotherapy. Dr. Sharan already mentioned about that. So what all? In fact, he read out a whole list of things. So I will tell you some important things which we are doing right now. Physiotherapy is चलने का problem है, वो physiotherapist handle करता है. पैर का problem है, वो physiotherapist handle करता है. Something called occupational therapy, ये काम का नहीं है, मतलब ADL, एक्टिविटीज़ ऑफ डेली लिविंग, जो इंसान अपने आप खुद का काम करना चाहिए, जैसे कि ब्रशिंग द टीथ, कोम्बिंग द हेयर, या अपने आप स्नान करना या खाना खाना या राइटिंग, एनी ऑफ दोज फंक्शंस दैट ही नीड्स टू डू बाय हिमसेल्फ टू बी इंडिपेंडेंट, ये एबिलिटी को एक्टिविटीज़ ऑफ डेली लिविंग बोलते हैं. दिस इज़ हैंडल्ड बाय द ऑक्यूपेशनल थेरेपिस्ट. इसके अलावा हाथ का जो भी है, अगर ये फिंगर्स में वीकनेस आया है या हाथ मूव नहीं कर सकते हैं, दैट दोज फंक्शंस द ऑक्यूपेशनल थेरेपिस्ट आर गोइंग टू वर्क विथ. नेक्स्ट कम्स द स्पीच थेरेपी. बहुत सारे स्ट्रोक या हेड इंजरी पेशेंट्स को अगर आपने देखा है, बोलने में दिक्कत होता है, उसको मालूम है क्या बोलना है लेकिन बोल नहीं सकते, तो उन लोगों को स्पीच थेरेपी का ज़रूरत होता है. एंड इट इज़ अ मेटिकुलस वे ऑफ रीवायरिंग द ब्रेन. बहुत ट्रेनिंग के बाद वो स्पीच वापस आ सकता है, डिपेंडिंग ऑन द एरिया ऑफ द ब्रेन. नेक्स्ट, द स्पीच थेरेपिस्ट ऑल्सो हैंडल स्वॉलो थेरेपी. उसको निगलने में मुश्किल होता है. कुछ लोगों को एस्पिरेशन हो सकता है, मतलब वो जो फूड का ट्यूब है वहाँ जाना चाहिए फूड, उसके बदले में वो लंग्स में जो ट्यूब जाता है वहाँ चले जाता है, तो एस्पिरेशन निमोनिया हो सकता है. उसको प्रिवेंट करने के लिए देर आर स्वॉलो थेरेपीज विच द स्पीच थेरेपिस्ट डू. ओके, दैट इज़ व्हाट दे डू. Then comes the cognitive therapy, या very easily known as memory therapy. लोगों को, बहुत सारे लोगों को मेमोरी प्रॉब्लम हो सकता है. उन लोगों को कुछ भी याद नहीं रहता, उसको अपना खुद का ही नाम भी याद नहीं रहता, फैमिली मेम्बर्स को पहचानने में दिक्कत होता है, या फ्रेंड सर्कल में उसको पहचान नहीं रहता, वो जो क्या काम करता था वो भी याद नहीं रहता है. बहुत, आई विल शो यू सम वीडियोज़, यू विल अंडरस्टैंड द ग्रेविटी ऑफ द सिचुएशन, है ना. देन देर इज समथिंग कॉल्ड बिहेवियरल थेरेपी. ये सारे लोग इधर बहुत अग्रेसिव हो सकते हैं या बहुत डिप्रेस्ड हो सकते हैं, जो कोई भी मोटिवेशन नहीं है, कुछ ठीक होने का उसको आशा नहीं है, फैमिली के ऊपर बहुत बर्डन हो जाते हैं, वो ऐसे समझते हैं, है ना. तो इन लोगों को बिहेवियरल थेरेपी का ज़रूरत है, राइट. एंड द लास्ट बट नॉट द लीस्ट इज़ पेन थेरेपी. बहुत सारे लोगों को बहुत सारे जॉइंट्स में पेन हो सकता है या मस्कुलेचर में पेन हो सकता है. वो पेन के वजह से वो बहुत उसको चलने में या कुछ काम करने में दिक्कत हो सकता है. तो हैंडलिंग दिस पेन्स विच मैंने हैंडल किया, तो बहुत मेहनत कम हो सकता है हमको पेशेंट के betterment में. I'll tell you some stories. This is, in fact, Dr. Sharan has shown you a lot of stories about rehabilitation. This important story is about, he was a banker, 62-year-old retired banker. Banker मतलब उसको नंबर का ज्ञान बहुत अच्छा है ना. पैसा काउंट करना, नंबर्स तो इट्स राइट हैंड. आप भी है बिजनेस पीपल, तो उस आपका भी नंबर्स बहुत अच्छा होगा. ही हैड अ कार्डियक इवेंट, लाइक कार्डियक अरेस्ट, हार्ट अटैक, ऐसा कुछ इवेंट हुआ. उसके वजह से एज अ साइड इफ़ेक्ट ऑफ दैट हाइपॉक्सिक ब्रेन डैमेज हुआ. ब्रेन के वो जो वेजल्स है, ब्लड वेजल्स है, उसमें खून बहना थोड़ा सा कम हो गया. इसके वजह से ही डेवलप्ड अ हाइपॉक्सिक ब्रेन इंजरी. उसके वजह से look what has happened. I'll show you some of the videos. This is the first, I think first or second day when he came to us in Mahavir Jain Hospital. Volume. No, volume is not there. Can you just set this? So this was the first or second day, and my therapist is trying to ask his name and identify who is around him. वो सीन है. After 10, scale 20.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 13.
So even in counting, he's getting a little confused. Now watch this. I have told him to write the same 1, 2, 3. He's trying to write 1, 2, 3.
1, 1 to 10 is? Next. 1, 1, 2, right? 1, 1 to 10 is? Next. 1, 1, 2, right? 1.
How do I forward this? Sneha. Sneha. How do I forward this? Forward this video. Bring it here.
1, 1, 1 to 10 is? Next. 1 to 10 is? Next. 1,
Anyway, I'm not able to forward that. Let me tell you what this video he is doing. He writes a 10 and this says, this is not 10. This is a mistake. And he erases that and he tries to write again. He writes 10. But he is not understanding that he's written a right thing. He's thinking there is a mistake. So these kind of confusions are there. So I'll show you this one. Again, banker, please remember. He says 2 plus 2 is 14.
No, that's plus. 2 plus 2.
Can you imagine a banker struggling so much for numbers? है ना?
So there are 3 dots here. There are 2 dots here. This is a plus mark, right? Yeah, this is a plus mark.
He doesn't even realize it's a plus mark.
Count these and then count these and write the answer. Count. So there are 3 dots here. Is your name Niladara?
Yes.
Very good. Is your brother Karthik?
No.
Is your brother named Balakrishna? Yes or no?
Yes.
Very good.
Yes.
Are you wearing a yellow shirt?
Yellow shirt. This one now?
Yes. Now.
Yellow. Yellow shirt.
So this is after 1.5 months of every day 3 hours of spending teaching him like small children 1, 2, 3, ABC, this color, that color, everything. Can you imagine? For a banker, retired banker, this can happen to anybody. And there are so many people who have this problem but don't know it can be treated. And this man today, he's fine. And he is able to, he is obviously retired, तो वापस काम पे जाने का ज़रूरत नहीं है, लेकिन ये बहुत पार्टी अरेंज करने का बहुत कीड़ा है इसको. तो he keeps throwing parties और लोगों को entertain करना इसका बहुत मज़े की बात है. So he is living his life like that. Okay, so these are something to do with cognitive retraining and behavioral therapy that we do. But to talk a little more about rehabilitation, about the physiotherapy part of it, speech therapy, the occupational therapy, I will bring up my team. Can I get Sneha up? She is in charge of the speech language pathology department in our organization. Please give a hand to Sneha.
Good afternoon, everyone. So today I am here as a speech language therapist, and I'll tell you about what all we do as a speech language therapist, how we participate in neuro rehabilitation with speech therapy services and swallow therapy services. So neuro rehabilitation is basically done for all those people who had a neurological injury like stroke, TBI, accident that would have caused some kind of injury to their head, any Parkinson's disease, spinal cord injury, and etc. And in such patients we see that they have speech issues, language issues, cognitive issues and swallowing issues, and that's where we come in. So one of the main things that happen after a stroke or a head injury is communication issues. So either they lose their ability to speak, they lose their ability to understand people, understand what is being spoken to them, identify their own family members, they lose the clarity of speech, they'll speak like somebody who's drunk, they'll not have a clear speech. So this is a 35-year-old male who had a road traffic accident. He was in a coma for a very long time. He had a tracheostomy tube, and then he underwent rehabilitation at Jain Hospital, and this was once he was out of his critical state. He had a lot of speech issues where it was not clear. So I'll just take you through a video where he went through the rehabilitation process.
If you want to, just
Here you can see his voice is very unclear. People are not able to understand what he's trying to say.
he did so.
So slowly through the rehabilitation process, the clarity gets better.
Lot of pebbles. Very good. Rocket. Pocket. Wow. So, which was the favorite?
So this is towards the final stage where he is able to answer to questions, speak clearly, say what he wants to say.
What are adventures? What is
Another field is the swallowing part of it. So after a head injury, they have different kinds of swallowing issues. One is a oral swallowing issue where they are not able to chew properly, they are not able to manage saliva properly. There's one side going like this, if you would have noticed, and because of that they are not able to chew and swallow. And the second part of it is in their throat level. We call it as pharyngeal dysphagia, where if they swallow, the food goes into the lungs, and this can end up causing pneumonia, and if they don't take enough quantity of food, they end up with nutrition problems. So, and another thing is the tracheostomy. So people, they get a tracheostomy for their breathing problems, and this is inserted into the neck, the trachea, and what happens here is they'll have problems in two ways. One is the breathing problem, then they'll also have their communication and swallowing problems. Because of the tube, they will have difficulty in speaking and they'll have difficulty in swallowing. So here also the speech therapists, they help in the rehabilitation in this way. I'll show you a video where we take care of both the tracheostomy and the swallowing. So we do something called as the VOST protocol that helps to prevent aspiration pneumonia, will help in starting feeding early as long as it is safe for the patient. So here you can see that the tube is blocked. This is a test we do called the barium swallow test to make sure that the swallowing is safe. If you see here, you can see that the food is passing through and it gets cleared from the throat. So once this swallowing test is done, we do the decannulation, that is the removal of this tube. And now she is able to eat everything like before. She is taking biscuits. So once they are able to take the food in adequate quantities, we get the tube removed from the nose, which is for the feeding. She is able to take water in a glass. So another thing is cognition. Along with the cognitive therapist, speech therapists also contribute to the cognitive therapy. Thank you. I would like to call Mr. Ganapati, who is the head of Department Occupational Therapy, to tell you all about his role in neurorehabilitation. Which one, sir? This one?
Yeah.
We'll take one moment.
So good afternoon, everyone. So for some of you, it may be a new word like occupational therapy, right? It's something related to job or something. People may think that you give job. So occupation, I have to tell what is the meaning of occupation. In our entire life, if we are occupied with some of one or the other activities. So this is what occupation means. It's not about job. So occupation therapy is an integral part of a multidisciplinary team because we are working together, we are putting the pieces together to produce the functional outcome. So these are the areas we are working on. First is self-care, that is like day-to-day dressing, eating, combing, all such activities. And then your work and your upper, like hand function and upper extremity rehabilitation. And vision, if you have to see,